the treatment for a patient who's suffering a stroke is very different depending whether it's an ischemic or a hemorrhagic stroke, because they are pretty much the complete opposites of each other. And then ischemic stroke is caused by a blood clot. So there's a lack of blood flow to the brain tissue, and now the patient is exhibiting some neurologic signs and symptoms. And the number one treatment for an ischemic stroke is a thrombolytic, because blood clots respond to thrombolytics, and thrombolytics just means that we're dissolving the blood clot. So we're giving the patient an IV medication in the hopes that this blood clot will dissolve and then restore the blood flow to the injured area of the brain. The other option is a cerebral angiogram, and that depends on the facility. Some comprehensive stroke centers might have a neurosurgeon on the team at all times where this is possible. And this saves the patient from having the thrombolytics, where they would go in through the groin or the radial artery and actually take a scope and look at the area of the brain where on CT scan that clot was detected. And then they can either try to remove the clot or dissolve it right there locally in the specific artery where we're having the clot located. Now, certainly the patients will also need to be on antiplatelet and anticoagulants to thin out the blood and make sure that any other clots don't get stuck in this area that's already been narrowed. Most likely, ischemic strokes are because of atherosclerosis, so the patient will need to go on a statin drug to bring down their cholesterol. And they certainly will also need to be monitored to see if they need any antihypertensives, because atherosclerosis and hypertension again go hand in hand. Now, if on the other hand we're dealing with a hemorrhagic stroke, so there's now bleeding, there's a blood vessel that has ruptured for one reason or another, and that blood that is escaping from the blood vessel is putting pressure on the brain tissue around the area. So first of all, we want to control the blood pressure so that we can lower the amount of blood that's being leaked from that blood vessel into the cranial cavity. And then we have a couple of options. It depends on how big the bleed is. If this is a massive bleed, then we would want to go in and surgically evacuate that clot and try the bleeding and try to fix that broken artery. But if it's a very small bleed and it's not producing significant enough symptoms, sometimes there can be watchful waiting, because our bodies have the natural ability to heal themselves, and so the regular clotting mechanism will set in and kind of seal off that leak there, and therefore the normal blood flow is restored, but we certainly need to keep a close eye on the patient. If the hemorrhagic stroke is caused by an aneurysm, it's a common procedure is coiling, and I have a separate video on what an aneurysm is, but it's basically the same procedure where the cerebral angiogram is performed to visualize the actual area of the blood flow that's causing the problem in the brain, and then that aneurysm can be coiled, and then the body will seal it off and normal blood flow is restored there. So thank you for watching this video on the treatment for the two different types of strokes. Also check out the other videos I have in this series so that you're very familiar with the differences, because like I said, they're exactly the opposite spectrum. Thanks for watching.